ideas around a take-up and use collection tool. You'll note that we're in the room 106H, and I was sort of joking that I guess it does pay to be on the board, because I've said, I really like this room. So every session that I'm hosting has been here. So sorry for those of you who couldn't find the room too easily, but I love natural light, and aside from the fact that you see all the traffic, it tends to keep people more upbeat in the afternoon. But we've had no trouble with that so far. People have been great, and I really look forward to this session. It involves my colleague and friend, Dr. Kelly Skinner, and Jasmine Borara, who's been her doctoral candidate, PhD candidate, working under Kelly. And it sort of began from a conversation a couple years ago now. This is why you should always go to the socials of a conference, because I asked Kelly what had ever happened to her 2007 paper that had been published in the Canadian Journal of Program Evaluation on the take-up and use of information. Because after all, take-up and use of information is ubiquitous. I mean, in every program we have, whether it's an information program per se, or a regulatory program, or a contribution program, people have to pick up information from a report or a meeting or some kind of an initiative and use it. And yet we don't measure that systematically. It's a key component of our influence. It's a key aspect of our performance, and yet it's not been systematically done. Kelly did do this as part of her doctoral thesis back in 2006, I guess, and had some really important insights. Two reasons. One, it was an establishment of a tool that had a lot of cool stuff to it, in the sense that it not only measured the uptake and use, but it also looked at whether people had barriers and why. And she'll tell you all about this when we get through. I won't steal the thunder. But also because it followed a theory of change in a very rigorous way. It was research-based. And what it's my great pleasure to do now is we've been funding this through PPX. As Eric mentioned this morning, this is one of our student projects. So we've been partially funding, and we're crossing our fingers, and I know there are representatives of CIHR in the room. I know you're not going to make the decision, but we're hoping. We've got an application in to have this more fully funded going forward. But it's one of the things we're trying to do as PPX and to grow, as Eric said this morning, with regard to the troika of the schools in Ottawa, but we hope to expand it elsewhere, and we are in fact doing it with Waterloo. So, again, Kelly Skinner is an assistant professor at School of Public Health and Systems at the University of Waterloo. She leads the new online Masters of Health Evaluation program. And so she does teach evaluation for a living. There's a whole lot of other stuff to her background, but suffice to say she's an expert in food security and in First Nations in the North. And most recently, she has taken this interest in overseeing this take-up and use of information. And Jasmine Borara is a PhD candidate, and her research is focused on food and nutrition policy, and she's an independent evaluation consultant working with not-for-profit organizations, co-founder of Active Healthy Kids in India. So in fact, they have a broad range of interests, but they coalesces in this knowledge uptake and use tool. Kelly.
Yeah, and thanks, Steve. Steve has been a champion for this project for a little while. As he said 2 years ago, he followed up with me and said, hey, whatever happened with that? And I said, well, I was really busy trying to finish up my PhD. And this actually wasn't a component of my PhD. It was like a side project. So as he said, my regular research is around food security and food systems in northern Canada with Indigenous populations. So it's quite different. Although some of the work that we're doing now around risk communication and health communication actually aligns with this take-up and use of information in a similar and related way. And Jasmine and I knew Jasmine because of our evaluation background, I guess. And so I had participated for a long time in the Canadian Evaluation Society case competition as a grad student. And then when I became the program lead for the Master of Health Evaluation at the University of Waterloo, I also started coaching teams that were participating in that competition. So Jasmine and I had been on a team previously. And then I asked her to help mentor some of the new teams. So we do have an interactive activity at the end. That's why we had this this Kahoot up here. So if you want to get the app on your phone by the time we get to the end of the presentation, that would be great, because we're going to ask some questions using that tool. It should be simple to just download and sign up with on your phone. So as Steve mentioned, we're going to talk today about the development and evaluation of a consistent rating tool for knowledge uptake and use. And this is something that I'm going to start by talking about the history of it. Sorry, I'm pressing the wrong button. So just an overview of what we're going to cover. I'm going to first start talking about measurement and evaluation of knowledge transfer, uptake, and use, just to get us all on the same page. And then talk about the history of this particular tool. And we're going to also look at some examples of adoption of this tool. And as Steve mentioned, the tool was published quite some time ago. So it was published in 2007 in the Canadian Journal of Program Evaluation. And since that time, I was contacted by many people who wanted to use this tool in some way. Most people wanted to adapt it for their own purposes. Their biggest question always was, has this tool been validated? We did have some preliminary validation work that we'd done, but really I've known for a long time that it required a more rigorous validation. And so we're going to talk a little bit about that and the process that we're going through to do that. Steve really wanted us to have the adapted tool here today. We're almost there. I'm hoping that we're going to actually use a version of this tool to evaluate the pre-conference sessions from the PPX Symposium and perhaps some of the other sessions, but also going to ask Steve to talk about his recent use of this tool and adapting it for something that he was working on, so he can speak to that. And then at the end, we have a bit of an interactive poll on this Kahoot platform with some questions. So we have a few questions to start. I normally attend very academic conferences, and so I came to PPX last year, and I didn't realize that there was, such a large group of government people who come to this conference. So can we start by show of hands as to what sector you work in? We'll start with government. Almost everybody. Private sector? Anyone? Consulting? Anything else that you would consider yourselves?
Academics.
Academia. Okay. Academia. Anybody else? Academics? 2, 3? Okay. So mostly government. And what field within the government might you work in? So start with health. So maybe 15%. Okay. Evaluation or results-based management. Okay, a good portion, close to half. Energy, a couple of people. Environment, 1 or 2. Okay, what did I miss? Technology. Okay, technology. Okay, a handful of people. What else did I miss?
Economic development.
Economic development. 2, 3? Okay, and some people I can see wear 2 hats, right? So sometimes you're, like myself, an academic and also have maybe a private business or work in another sector. Okay, do you evaluate knowledge translation products or processes in your work? So things like if you send out a report or document, do you evaluate what happens after it goes out? Or if you have a training session, do you evaluate that? So some people are nodding their heads, a few hands here. And how many people have heard of this tool before? We did have a session last year, so there's a couple of people. Were you here last year and that's why you heard about the tool, or do you know Steve? Steve, okay. I know, Steve's been the biggest champion for this, which has been great. So I'm going to start by just reviewing some definitions so we're all on the same page. So knowledge transfer and exchange, it's really about knowledge generated through research and other activities, synthesized and disseminated to relevant stakeholders. And these are, I'm referencing some of the big KT people in the field, so Ian Graham. And then we're going to talk a bit about what a knowledge product is. So this could be considered any information product used to share information with others. So you can think about it as document, data, website, workshops, training activities. It's commonly generated as part of a dedicated knowledge transfer and exchange or dissemination strategy. It might also be part of a program, organization, or I'm not sure why it's skipping on its own here, or initiatives' general deliverables. Okay. So if we want to evaluate knowledge translation, often organizations are increasingly monitoring and evaluating their knowledge products or processes. From what I understand, in the government, this is a common thing. It also happens with other organizations. A lot more nonprofit organizations are doing this, and even things like, for example, Ontario Trillium Foundation requires their funded programs to have a third-party evaluator to evaluate their projects. There's a variety of measures being used to evaluate knowledge translation and exchange and knowledge product effectiveness and impact. However, few tools have incorporated theoretical frameworks, and this is sort of the basis for why I developed this tool. I started in 2004. And then even fewer tools can be applied across disciplines or unique knowledge products, so aren't really generalizable really to other areas. So when we're talking here about knowledge uptake and utilization, what I'm really referring to is the process of implementing research-generated knowledge into practices and policies. And we're also now trying to incorporate non-research-generated knowledge, so maybe it's practices in general, and they're not necessarily research or evidence-based. And the key priorities are to use findings, often in written form, and apply these to health policies and programs. And, as you can see, we used health there. The actual initial project was health-based. And so the initial goal in 2004 when I started this was to find quantitative models or scales to be used to measure the reach and uptake of disseminated practices. It was part of a best practices in type 2 diabetes project. And we were looking to see these interventions that had been disseminated, were people using them and taking them up, and how are they using them? So that was the original reason for this tool. And a lot of this was based around having resource stewardship, making sure there was effective dissemination and interaction between the producers of that knowledge, so the producers of the interventions or the knowledge products, and the knowledge users, so the audience that they were trying to promote their knowledge product to. So this is a little bit of the history of the tool. It started with a large literature search for published and unpublished and gray literature. I retrieved a whole bunch of sources and found numerous models and strategies for effective dissemination, but really no concrete measurement tools. I looked at key papers and looked at these articles and compared scales across each other, and then developed those into a questionnaire. So I used those ideas and that theory to build the scale categories and to develop specific questions. And the important thing here was to actually operationalize those concepts into specific items and questions that could assess the reach and uptake after someone had disseminated or transferred an information or knowledge product. I'm kind of scared to press this button because I'm worried it's going to go 2 slides ahead. So the result of that was this paper that was published in 2007 about the development of this tool, and it was originally called a tool to measure knowledge exchange outcomes. We have since sort of rebranded the tool and now are calling it the knowledge uptake and utilization tool, as it better describes what the tool actually does. And really the tool is intended to measure the uptake and utilization of information, knowledge products, knowledge processes. And the original tool had 2 main sections. So the first section was a series of 44 questions that looked at the use and uptake of information. And the second section was about non-use. So when Steve spoke at the beginning of the talk about looking at what the barriers were, so there was a list of options that people could choose based on why they might not take up a knowledge product or why they might not take something into their practice. And those specific categories were actually based on research that had been done by Maureen Dobbins. She's the lead of the National Collaborating Center for Methods and Tools. And then the final piece of the original tool was to score the level of use, to see the level of use that somebody had, the level of use of that particular knowledge product or what the person had taken up. So it turned into a 44-item questionnaire with 9 categories. And the questions were really informed by the literature as well. So not only were the categories based on theory and background, but how the questions were designed were also based on that. But from what we've heard, 44 questions is way too long. It's way, way too long for anybody to use to answer. So this is one of the things that we've been trying to do, is to cut this down, but to still keep a lot of the theory there. So with respect to the categories, the tool was originally based on the stages of knowledge utilization from Knott and Vildovsky, which was research that was done in the 1980s, actually. And then I added 2 categories. The first one was awareness, and the other one was effort. So Knott and Vildovsky had 7 categories: reception, cognition, discussion, reference, adoption, implementation, and impact. And then these additional categories were added based on how somebody might take up some information. So you have to be aware of something to be able to take it up, obviously. And then this piece about whether you are making an effort to favor this information or knowledge product over others was another piece that I added based on reviewing the rest of the literature and looking at what the other sort of conceptual models were saying. So initially, we because we were building this for best practice documents that were being disseminated, we used the word document. So, for example, under awareness, we had a questionnaire to determine whether someone knew that the document existed. And then an example from the adoption section: have you adopted a practice outlined in the document? And those were based around the original purpose of the tool was to measure these best practices documents. But now we have been sort of trying to make this more generalizable and using terms like knowledge product, or where there's an open space where someone can put in the name or title of whatever the knowledge product happens to be that they are trying to measure the uptake and utilization of. So some examples of application of the COOT over the past, it's been more than 10 years now. So the Public Health Agency of Canada, Canadian Partnership Against Cancer, Public Health Ontario, Health Canada, National Collaborating Centre for Public Policy, and others. So for example, the Canadian Partnership Against Cancer used it as part of a toolkit. For Public Health Ontario, they were assessing the knowledge uptake of individual public health unit Healthy Baby, Healthy Children process reports. And for Health Canada, they were using it as a standardized instrument for their funded projects to enable grantees to assess impact at the project level and to allow for the funding program to roll up an analysis at a higher level. So 7 recipients of Health Canada funding used it at that point. So as a result, the COOT is really a theory-based questionnaire tool to generate performance information and evaluate how information or knowledge products are taken up and utilized. And now we're going to talk a little bit about the current work that we're doing to redevelop and build validity evidence for this tool. So for example, fewer questions, because 44, as we all know, is too many, and then also changing the language. So a lot of the initial funding from PPX has helped to support the first 2 phases. So the first phase was to gather and synthesize new information, and Jasmine's going to talk about the scoping review that she did to do that. And then we're also gathering and evaluating content validity information using subject matter experts and experiential experts. And then we're going to be, we've already started this, redeveloping the tool itself with evidence from phases 1 and 2 of this process to develop a shortened tool that has more generalizable language and that can be used in a more general way. Okay, so I'm going to pass it to Jasmine. And she's going to talk about the piece that she's been working on.
Great. Thanks, Kelly. So first I'll start by talking a bit about the scoping review that we've conducted, because the last time the literature search was conducted was back around 2005, 2006 when the tool was developed. So we wanted to see if any other assessment tools exist, and if that could help inform some of the updates that we're making to this tool. And we also conducted some interviews with some knowledge users. So we spoke to some of the agencies like Health Canada and Public Health Ontario to find out how they'd been using the tool, as well as what types of adaptations they had been making. So I'll share a bit about both of those things. So I'll start first with the scoping review. As I mentioned, the key questions or objectives of this review were to identify tools and frameworks that are being used to evaluate knowledge translation, uptake, and utilization. And second, to identify what evaluation criteria or domains are being used as part of these assessment tools. Just a brief note about some of the definitions that we used in this review. First, knowledge products and processes included, but were not limited to, any documents such as reports, websites, activities such as workshops or meetings that had the intention of sharing knowledge. And evaluation referred to a formal assessment of the knowledge product or process with respect to its usability, its uptake, its utilization, relevance, as well as other domains. So we conducted a massive literature review and looked at databases PubMed and Scopus, and we came across 6,500 articles that were part of our search criteria. We were able to screen out most of them at the abstract screening stage, and then looked at the full text of 292 of these articles. After assessing it against our inclusion-exclusion criteria, we came down to 62 articles that we felt shared some sort of framework or assessment method for knowledge uptake and utilization. In addition to this systematic screening of these databases, we also did additional record screening through citation tracing and hand searching through relevant journals. And we came across, in total, then 72 articles or assessment tools. So first, you can see we've broken down our results based on the types of tools that we found. We came across 23 tools that we would call generalizable, meaning that they could be used for any knowledge product or process type. However, this doesn't necessarily mean that they could be used across disciplines. So, for example, if a tool was meant to assess a document or report in the health setting, it may not be transferable to environment or to energy or something else. We came across 36 tools that were knowledge product specific. So this means that an organization or the authors had developed this tool to assess perhaps a website or a mobile app that they had developed, but the questions were tailored to that product that they had made. We came across 9 discipline-specific evaluation tools. So this means that the questions were specific to that discipline. So if we're using health as an example, chances are you could use it across different knowledge products, but only within that discipline or sector because of the language that was being used. And we came across 4 evaluations of knowledge products or knowledge transfer exchange processes that used alternative methods. So this could be something like qualitative interviews or focus groups, or Google Analytics to identify how a product or process was being used. So just to give you an example of a knowledge product specific tool, we came across something called the Mobile App Rating Scale, or MARS, and this tool was designed to, of course, assess mobile health apps. It's a 23-item scale that assesses respondents' engagement with the app, its functionality, the aesthetics, information quality, as well as subjective quality. And all of these different domains are assessed using a series of questions, and you can see some examples on the far right with respect to some of the questions they asked about the information that the app contained. So respondents were given up to 4 to 5 response options, and they worked through this 23-item scale to give their feedback. As I noted, there were 23 generalizable tools that were not specific to knowledge products or processes. However, out of these 23, there were actually only 2 tools that could be used across disciplines. One of them is Kelly's tool, the COOT. So it could be applied to any knowledge product or process, but also was not discipline or sector specific. And the second one that we came across is called LOCUS, or Level of Knowledge Use Survey. So similar to the COOT, it's a 47-item questionnaire. The COOT is 44 items. However, there are some differences in the domains that are being assessed. So the locus looks at awareness of that knowledge, product, or process, non-awareness, the respondent's interest, as well as their use of that specific product. And here they define two different types of use. The first was use as intended by the knowledge creator and use as modified by the knowledge recipient. So I have some screenshots of their tool. It's quite a lengthy tool, and unlike, I don't know if you've seen the COOT yet, but the COOT is quite easy to work through. So even though it is 44 items, you are able to work through the skip patterns. It's a lot of yes-no questions, and it's quite streamlined to work through. The locus, on the other hand, has a combination of yes-no questions, but also multiple choice or select all that apply. So it's quite lengthy and very detailed. So you can see here, the first question says, I'm seeking details on whether the new knowledge from this study will be useful, but have not yet decided to use it. Click yes or no. And it says you indicated that you're seeking details, and then it looks for more information on the type of information that you'd like from there. There was another pop-up. Okay. This is a tool that's available online, but this is just to give you an idea that after doing this exhaustive search, looking at 6,500 citations, there were only 2 that we felt were applicable across all disciplines. So that was an interesting finding to come across after many months of searching. So overall, the key findings from our scoping review was that the majority of the tools that we uncovered, whether or not they were validated, had focused on usability. Most of these tools were developed for a specific project or purpose, which is probably to be expected, and very few tools could be applied more generally to different knowledge products or processes irrespective of the discipline. So some of the advantages of the COOT is that it could be applied across knowledge products or processes, and it assesses 9 different domains and doesn't just center around usability. And as compared to some of these other tools we came across, it's one of the few that actually captures how the knowledge product or process is being used, which is a very important feature. So I've created this graph here just to give you an idea of some of the commonly used domains. There were 136 unique domains or categories that are being measured from those 72 tools that we shortlisted, but here are some of the ones that came up most frequently. The first one, as I noted, was usability. It was used in 40 of them. Aesthetics was also commonly assessed. But interestingly, there are many different terms that are being used for use. So we have usability, use, ease of use, usefulness, utility was another one that had come up. And what we found was that different studies or different users will define these terms in different ways. So that, of course, changes how that term is being operationalized and how this is being measured. So this is why we've kept these domains separate here, because we wouldn't group them since they're all measured in slightly different ways. But what we see here is that perhaps in different disciplines and different sectors, we're using different terms. We may or may not be measuring the same things, and therefore we are asking different questions to capture use. So now I'll switch gears a bit to talk a bit about the feedback that we received from the COOT. We've done 12 interviews with COOT users, and they came from a range of organizations. Some of them were from academic or research-based organizations such as universities, governmental or partner governmental organizations, private consulting firms, as well as nonprofit agencies. The user or user organizations are from a range of disciplines and sectors. Public health and healthcare was quite common, education, evaluation, regulatory affairs, and the energy sector as well. So with respect to what the COOT was used for, the main projects that our users reported were evaluation-centric. Some of them were research, and others were centered around knowledge transfer and exchange strategies. They had used this tool to assess a variety of products or processes, including workshops, organizational or project reports, their training plans, toolkits that they had developed around knowledge transfer and exchange, their overarching KTE process or dissemination strategies, as well as specific knowledge translation reports that they had put together. Many of them did report making adaptations to the tool. As Kelly had mentioned, length was a consideration, and there were other adaptations that were also made. So with respect to content, many of the users actually revised the questions to make it more applicable to their own knowledge products. Sometimes this meant that they just inserted the knowledge product name in the question. So when asking about, are you aware of this tool or this report, they would just cite the name of the report, so it's easier for their respondents to understand what they're talking about. And in other places where we had initially used the language best practice, they would transfer or change some of the terminology there to make it more applicable for them. So many of them cut the length. So this might mean not using all 9 domains or subsections. In other cases, it might mean cutting questions from each of these subsections based on what they felt was appropriate. But what this meant was, in the end, they could not use the scoring mechanism that's at the end of the tool, as the skip patterns wouldn't allow them to do so. We also learned that there was a range in how this tool was administered. Many people had adopted this survey to online, so they used an existing survey platform to take advantage of the skip patterns and to help streamline the delivery. Some people had actually delivered this over the phone because, depending on who their respondents were, they thought it was helpful to walk through some of the questions with their respondents, and there were also a few who reported using paper-based. So across the 9 domains, we can see that some subsections were used more commonly than others. The most commonly used section was awareness, and this question appears at the very beginning of the survey and asks whether or not respondents are aware of a specific document or knowledge product. And some of the other commonly used ones were reception, discussion, adoption, and implementation. So taking into consideration which subsections were used most and also what types of adaptations our users were making, all of this is being used to inform the revamped COOT that is currently being developed. So I'll just quickly tell you a bit about some of the specific feedback we received. So I conducted some interviews with these users and asked them a series of questions to get some more detailed input. One of the questions that I asked them was, have you used or considered using any other knowledge uptake and or utilization tool? As you remember from the scoping review, there are a whole host of other tools that are out there that they could have used that maybe might have been even more tailored for their specific knowledge product or process. So we were just curious to know what had people been using or what were they aware of. And interestingly, at least from the group that we spoke to, most of them said that they had not considered using any other tool. They said that the reason they liked the COOT was because it was easy to adapt, it was easy to administer, and it provided them with quantifiable information which made it very tangible. And perhaps this is not surprising because out of all the tools that we looked at, only 2 were truly generalizable to various disciplines and to various knowledge products or processes. We also asked them for suggestions for improvement. And of course, one of the pitfalls that they noted was that the tool is fairly long and that it intimidates people. And if there was any possibility to have an abbreviated or shorter version with slightly different intentions for their use, this was something that they would consider using. So of course, taking all of this feedback into consideration, taking some of the most recent evidence, we've been compiling all of this in order to make some of these updates. So we'll just give you a brief idea of some of the nature of some of the revisions that we're making. The first thing was we're going to be including a knowledge product definition at the very beginning. We feel that having a definition at the start would make it much clearer to the users what this tool is intended for, and also providing them a place to include that knowledge product or process's name so that they can be much more specific as they're going through that list of questions to aid respondents as they work through it. Another type of revision we're making is cutting down the tool and refining some of the phrasing. So in the original tool, the reception section has 4 questions, and we have now cut this down to 2 questions, just sort of merging some of them together and also taking into consideration what questions people had reported using. And of course, inserting the knowledge product name. I'll just turn it over briefly to Steve to share a bit about his own experience with the COOT and some of the adaptations that his team has made.
Thanks very much. So this one I applied it to workshops. I do a lot of workshops, and we had done something with the Canadian Evaluation Society in Atlantic Canada. So there were 3 days in 3 different cities. And what we did was, within about a 4-week period, it's hard to gauge how long you want to do it. The longer you go, the less they remember, and the worse your reception rate is going to be, or your response rate. So we did 1 reminder. So we sent it 4 weeks, and then I did it again in 6 weeks just before Christmas. And actually, we ended up with over 50% response rate, which was half decent. So you got to remember now, you're talking about a 1-day or a little bit less than a 1-day workshop. And so I didn't go bother with awareness. And what I really went with was more or less ease, discussion, use, and then consideration and use. And then asked for a couple of open-ended questions. So I wasn't able to score this against the 9 criteria, but for my purposes, that wasn't important. What I wanted to know is what people got out of the workshops. And for me, it helped me quite a lot to get a lot of information about what they remembered, what came up, what didn't come up. So I wasn't as interested in helping them overcome their barriers to use. I got a little bit out of it, but in general, what was nice about this process is it starts with a few yes nos. Did you were you there? Was it easy, sort of thing, and it gets people answering, and then you got them to sort of rate a little bit of the use. Did they discuss it? And these are all linked to the theory. I mean, if you've discussed it, if you've considered it, and so on. I got still quite a few, as this being evaluation workshops in 4 weeks. People said it's too early, to have used it, but they had a willingness. So that tells me that, were we to follow up further, that would probably give us a little more information. But what was most important to me was that it went through these easy to answer questions, and then most of them answered the open-ended. In other words, it warmed them up with the yes/no, it gave a couple of rated, and then it gave some open-ended questions, which I felt, having done a lot of research surveys over a stage of a career, that this was actually a pretty good response rate for an online survey that we sent after the fact to people who didn't have a strong commitment to respond. I would say there are a couple of folks in this room that we're trying to do some further work with, that there will likely be more strength of response, and I'll keep this reference very general. We applied something like this in an evaluation study where we were going after particular professionals to get their response to a major report, and we got a very strong response. In other words, a virtual 100% response from those people. So again, where you have a high commitment and a significant report, which remember was the original use, it was really useful. So we're hoping in this one that a couple of folks in this room are involved with, that will be the similar situation there, that we could expect an even higher response and something from an online. So that's what I liked about it. I don't know if anybody wants to ask me questions now or later, but I'll turn it back to the team.
How many people were at the workshops?
We're looking at probably 25 to 30 in most cases, and so we got an over half, like I was getting 55% on that, which isn't bad. I mean, a lot of times I know any of you are doing workshops, and especially if you're serving, 4 weeks after the fact. I mean, maybe it's just that Atlantic Canadians are friendly. I don't know. But it was very, very helpful, and people wrote in, and as I say, for the first time ever, I was really getting what was resonating and what was not. And that was helpful.
Yeah, and I think the time of when you want to find out whether people are taking up and using the information is really important to consider. And I think that kind of varied for the people that Jasmine was interviewing. Mm-hmm. I don't know, Jasmine, if you have any sense of the range of time that people
That spent on it?
the time between when they had maybe disseminated their knowledge product and when they had used the COOT to evaluate how that knowledge product had been taken up.
Yeah, it really just depended on what that product was. In some cases where it was more of an activity-based, so if it was a workshop or a meeting, the COOT would be administered immediately afterward just to enhance recall of that event. But anytime it was a document or a report or some sort of toolkit, there was certainly a lag time between when this was administered, just because of the time it takes to disseminate. And I guess they're also waiting for that uptake to happen so that they're able to effectively measure that.
Well, and I think if we go back to the presentation that we saw just before this one, where he was really talking about, this socialization piece. And I think that's where some of these questions get at. So you have to think, at what point do people start actually moving things into their work and into their practice after they've read something? How long does that really take?
Well, let's poll the group. We're gonna
All
try.
right.
We're gonna try and how many people took a pre-workshop?
A pre-conference course.
workshop.
Yeah.
So how long do you think we should follow up with you to see whether you've tried it? Something. Anybody got an idea? Yeah, Katie.
You need like 2 points. I think I said this in the workshop, a 1 month and a 6 months, because you don't necessarily do the activities. I'm not making a logic model every single day, but give me a month to kind of think about it, and then 6 months later, did it really impact my work?
Yeah.
I guess that's how.
So I'm hearing you say the 4 weeks wasn't a bad idea that we tried, but that we should follow it up. Others feel that way? A month would be right? Okay, that's what we're going to do. Thank you.
Yeah, so I think too, there's also sort of probably a drop-off period where the longer you go from when you've actually participated in something or seen a document, the less likely you might be to use it or remember about it. So I think it's finding that sort of spot in between. So this is good and helpful. Thank you. So a little bit more about our current, where we're at. So we have done this, Jasmine worked really hard on the scoping review. So we've been in this knowledge gathering phase, and also with these interviews with people who have used the COOT in the past. We're at the point of building, and we're calling those people the experiential experts because they are people who have used the COOT. So we're trying to build a community of practice right now of also subject matter experts in evaluation, and knowledge translation and other related fields to sort of look at this redeveloped version that we're making, and to provide some feedback on that. So we're looking for people who might want to be involved in that. We're currently working to use some of this information from both the scoping review and the interviews to redevelop the questions to make them shorter. And we do have a shortened version right now. It's about 15 questions. Steve's version had 10 questions plus 2 open-ended questions at the end, so his was 12 questions. So that's a really big difference from the original 44 questions. And so the stage we're at right now is really this redevelopment phase. And then also as a part of this future phase is the plan to actually pilot test the COOT with a whole variety of knowledge users, so both health knowledge users and non-health. And we did, Steve didn't say what grant we have submitted, but we have been getting these special research project funding from PPX, which has been great to get us going on this, but we've also been applying for CIHR funding. So we have a new CIHR grant that we'll find out about in July. And I've been told by my research office at the university that maybe if CIHR doesn't fund it, we should try and get money from SHRC to do it, because it could really apply across social sciences as well and not just health. And in that grant, a lot of the funding was to go around this pilot testing phase. So, I mean, we asked for money for some of the earlier phases, but because of the PPX funding, we've already been able to move through some of that. So this pilot testing phase really sort of comes after this community of practice. So after people have looked at the redeveloped COOT, so subject matter experts and experiential experts to examine this. And then the pilot testing phase, we do have some of the, Public Health Ontario has already used it, but they're also interested in participating in the pilot testing phase. We also have Homewood Research Institute. Our non-health knowledge user is the Homelessness Hub. And we also have Sunnybrook Health Sciences Center who have been involved. And we have some other people who also are interested in being pilot testers of the redeveloped version of the tool. But for the CIHR grant, those are the groups that actually were included. And I've been working with a psychometrics expert on this, so it's not just coming from an evaluation background, but she's been helping to cut down the questions to still look at them in a way that we can test them using factor analysis and things like that. So there's this whole other piece that is not really my area of expertise necessarily, but that we have some experts around the table who are helping with that piece to make sure that the way that we're going about trying to build this validity evidence is actually based around people who have this psychometrics background. So as a part of that, one of the things is this table of specifications that has been developed for these subject matter experts and experiential experts to actually look at each of the questions and to consider those questions, whether they think it measures uptake or utilization or both, whether they have any comments on each of the particular questions, whether they think that question actually is a part of that category. So as we mentioned, there's still 9 categories, and even though we've cut it down, we still have some questions in each of the categories. So for example, the awareness category, we actually had originally 2 questions, and they have been turned into screener questions. Steve actually did that in his tool unknowingly, and then when I went through it with the psychometrics person, she's like, these are really screener questions. So determine whether somebody has actually accessed that knowledge product or they've been to the training session or workshop. For the reception category, we originally had 4 items and it's been brought down to 2. For cognition, we went from 6 to 3. Discussion from 6 to 2. Reference from 4 to 3. And effort from 2 to 1. Adoption from 6 to 1. Implementation from 10 to 2. And impact from 4 to 1. So that's how we got from the original 44 questions down to a screener plus 15 questions where we're at right now. Steve really wanted me to share a version of the tool, but I felt really hesitant at this point because I'm still dealing with some language around it. But I am going to have something ready to evaluate these pre-conference sessions shortly. So that will be the first real application of the redeveloped version of the tool that's going to get used, and we think it will be
So in a month?
in about a month. Based on what people have said, we had thought 2 to 3 weeks, but maybe a month is best. So some of the next steps are to, this scoping review that Jasmine has been working on is submitted to a journal, and we also have a protocol study. So the psychometrics expert I've been working with, we've basically written up the methods of building the validity evidence, and that's going to be a separate paper. We have been trying to build this community of practice, so we have a list of people who are interested in being these subject matter experts and experiential experts. The interviews that Jasmine did with Coot users, that's another paper that we're writing up right now. We've also discussed a Coot manual, so things like how do you choose who your audience should be, how long should you wait, which is one of the questions we had here, and we'll get our subject matter experts and experiential experts to help us determine some of those things for the user manual. And things like, if you wanted to make any adaptation, how can you adapt it and still maintain the psychometric properties so that you're not compromising the scoring of the tool and the validity of the tool itself. And so we do have this funding application in to do the pilot testing of the redeveloped tool, and there's also plans to develop an app so that people can more easily use it, so that you can actually just insert your knowledge product name or the knowledge process, and then it's a lot more easy to follow along. You don't have to put it on your own survey platform. It will just be something that you can send out more easily. So we do have this interactive poll on Kahoot. So we did ask people when they came in to download the app, the Kahoot app. So if you go to Kahoot, if you search for Kahoot, you should find it. So I'll give people a few minutes who didn't do that when we started. I think it's once I go into here. So once you go into the Kahoot, oops, it isn't a mouse, okay.
Do you need to register?
Just a second. I'm going to give you a code. So once you're on there, is there a spot, do you see a spot for a, a PIN number. Okay, I'm going to give it to you in a second. Is everybody ready for the PIN? All right. It's showing up here. Okay, so this is the PIN number 244574. If you can put that into your... And once people have put their names in, they'll show up there. You can just use initials if you want. It shows us how many people are going to be playing the game. I don't know. Has anybody used this before, this tool? Somebody at the front here? I use it in my class sometimes just to get sort of a quick picture of, student background. I used it last week in my undergrad Indigenous health class. I was asking them if they knew specific terms like 60 scoop and if they knew what self-determination was and things like that. So sometimes it's a fun tool to use because you can see the sort of results right away after people sign up. So we have, okay, I'm going to wait a little bit longer. We have 22 people. Is there anybody else who's still trying to get in? Anybody having trouble that wants to participate? We're at 23. Okay, 24. I think last year we had 25.
We hear 25.
Can we get 25? No? Oh, good. We're at 26. Good. Okay. Are we waiting for anyone else? I'm going to start the game if we're all ready to go. Everybody's ready? It's not really a game. It's questions, so you just answer the questions. Okay. Are you ready? 5 questions. Do you have a need for knowledge uptake utilization assessment tools in your practice? Yes or no? Where's number 26? 26.
Yeah, there we go.
All right, so the majority of people, 23 out of 26, a couple people said no. All right, so that's great. Do you already use some knowledge uptake or utilization assessment tools in your practice? Or something that you would consider that based on sort of the definitions that we have provided today? Okay, so most people have not. A few people have. So for those people who have, we are interested in knowing what tools you are using. So does anyone want to volunteer before I move on to the next question? Yes.
I work at the Canada School of Public Service.
Okay.
We have a dedicated survey team that uses a modified Donald Kirkpatrick model to survey learners. You probably know about this. And mostly the team focuses on either level 1, which is kind of like satisfaction, or level 3, which is knowledge application.
Okay.
So I can put you in touch with the manager of that team, and you probably have a lot in common.
Sure, and actually satisfaction tools were one of the things that came out a lot in the scoping review that people were using, so that's not really a surprise.
Interestingly enough, deputy ministers aren't particularly interested in whether their learners are satisfied after they come to the school.
Right, interesting.
What they're most interested in is, did my employee complete the training?
Okay,
In other words, did they skip out or not?
yep,
And the other is, what is my organization gaining as a result of my employees going to the school for training?
right.
Which
And
gets a
that's-
little bit at this, I think.
Yes.
Yeah.
Yes, this is a little bit here.
Who answers that question?
Deputy ministers answer those questions. Or you're saying who answers the question as to whether the learning is being applied?
Yeah.
Well, the learners answer it, and their supervisors answer it as well in some cases.
Thank you. Anyone else want to share what kind of tool they might use that measures knowledge uptake and utilization in your own, even your own definition of that? There were 9 of you. Myers? Like Myers-Briggs?
No, liars.
Oh, liars. So there's 8 liars. Okay, there's somebody.
We're using yours, well, Steve's.
Oh, you're using the Steve's version of our tool. Yes. Okay, great.
And perhaps a slightly modified version of your longer one.
Right. Okay, perfect. I'm happy with that too. Yep.
Just a comment, maybe people were confusing the question with client satisfaction surveys.
Ah.
We do in our department, but they don't measure knowledge of.
They don't so much. And the interesting thing about this scoping review was that it was really difficult to use narrow keywords because we were getting nothing. So we had to make it really broad, which is how we ended up getting these satisfaction tools as well. But we wanted to make it broad enough so that we actually could still capture some of the tools that we were truly looking for that were similar to the COOT, or trying to find something to see if there was anything out that was similar. All right, Jasmine tells me I have 5 minutes, so I better go to the next question since we only have a few people who wanted to tell us what tools they're using. Okay, who is your biggest audience for your knowledge products? Staff, general public, organizational management, or some other? And I know this is kind of vague. You have to choose which knowledge product, but in general, like what you develop in your team, who is the biggest audience? Okay, so, yeah, interesting split here. Okay, so nobody said general public. Just under half said staff. Just over half said, or actually exactly half said organizational management, and 3 said other. So for those who said other, who is your audience? Yep.
Well, CIHR creates knowledge products for researchers applying for funding. So
Right.
it's the applicants that are accessing those knowledge products. I have no involvement with it, so I don't really know what happens beyond that. But,
Right.
it do create-
I am actually one of your audiences then. Yeah. Okay. Yes, and I have watched videos on the CIHR page for sure.
I'm so glad you raised that one, though, because that's not a use that many people wouldn't realize. But think how important it is that your target audience for applications understands the message and will use it, right? I mean, and we don't test that very well. We may be losing really important applicants because our tools aren't clear enough. Very, very good. Yeah.
Well, and if we wanted to talk about Indigenous health, I could have a long conversation about that piece. But
And that's it. Success to the successful. You get that syndrome if you reach the people who already know. Yeah.
okay, thank you. Was there anyone else who wanted to say what their other referred to? Yes, at the back there.
For us, it would be industry. So
Industry.
yeah, like in our case, we have a report that focus on the future of energy, and so part of our audience would be industry.
Industry.
Like
Okay.
where we're going with this.
Yeah, and I could see depending on which sector you're in, that could vary as well. And there was one more person. Did they want to say who their other was? It's okay if you don't want to speak up. All right. Jasmine's gonna cane me off the stage soon. Okay, question 4 or 5. How do you normally engage with that audience? So the one that you referred to as your biggest audience. Do you have in-person or online meetings? Do you have a formal feedback system? Do you have an informal feedback system where you contact them by email or in person, or other? We had trouble thinking of the response options for this, so maybe they're not quite clear. Maybe we'll have a lot of others.
Maybe more than one.
Or maybe people who wanted to choose more than one option.
We won't have any other.
27? Who joined us? All right, so I guess half, now that we have 27. So 14 people said meetings in person or online. Where's the normal way that they engage with that audience? And then the second most common was informal feedback systems through in-person or email. And then a formal feedback system, and nobody said other. Did people want to choose more than one response here? Probably, eh? Yeah, because you probably engage with your audience in multiple ways. But we were sort of looking for the main way that you might engage with that audience. So that's kind of interesting too, to know that in-person meetings and online meetings are the main way Okay, last question. Could you see yourself using something like the Coot? Yes, no, don't know. All right, so the majority of people said yes. Some people are unsure, and I think that's probably because we didn't show you exactly what all the questions look like. But that's helpful. So if anybody does want to get in touch, I am keen to have people get in touch. And I have my email. I'm just pulling this up because I have my email on one of the later slides. So if you're interested in joining the community of practice, you see yourself maybe as a subject matter expert because you've used the Coot, or you see yourself as an experiential expert, as maybe an evaluator or in knowledge translation, knowledge uptake and utilization, and you want to participate, please contact me.
And this will also be all made available through the PPX website, so
Yes.
they can do it any way you'd like. Kelly is the best source, but we'll make sure that you're in contact if you'd like to do that from here.
Yes, and so through this, also I'm excited that we're going to be using a version of the Coot for evaluating the pre-conference workshop, and so testing it out very shortly.
And I think you'll see this is an example of evaluative thinking built into a tool. Evaluation is a very important subject. We've got a very important panel to finish our day that will be covering this, so I'm going to encourage you to all rush over to make sure that we take part in our closing plenary. It's going to be a great one. I want to first thank Kelly and Jasmine for a great presentation, very engaging. Thank you so much.